I'm Dr. Johnny De Beer.
And I'm Dr. Adele Becker. Having been diagnosed with arthritis and preparing for joint replacement surgery, it is important to understand the factors that influence this disease process. You may want to know what caused this so that you can make choices and changes that will prevent arthritis to progress and develop in your other joints.
When patients come to me, they ask me, what did I do that I got arthritis? Did I do too much sport? And will it affect my other joints? And if you look at what the CDC, the Center of Disease Control, shows, that is actually more common than patients realize. That up to a third of patients people in America suffer from arthritis. That's 43 million people, so it is a common problem that affects Americans, and we're not far behind the American statistics. There's two graphs that we're going to put on the screen for you. The first one is the incidence of hip replacements, starting in the year 2000 up to 2010, and in that decade it has doubled in incidence. And when you look at the next graph on the screen, there's the incidence of knee replacements. Now in women that's increased 99%, which means it's doubled, and in men 86%, so not quite doubled yet, but even knee arthritis is on the increase, both hip and knee arthritis on the increase.
But surely medical science would have found a way now to start decreasing this incidence of arthritis.
Well, fortunately they did the studies on that, and they looked at the projection, what is going to happen between 2016 now and 2030. And they've shown that the incidence of knee replacement is actually going up. It's now currently sitting at about 750,000 procedures, knee replacements a year in America. And by 2030, it's going up to 3 million. That's more than 3.5 times. So science is not reversing the cause of arthritis currently.
It is also very interesting that with the rise of arthritis, other diseases like cardiovascular disease, diabetes, obesity and cancer has also risen dramatically. And science has irrefutably proven that all these disease processes are linked to lifestyle.
Well, up till the 1800s, the Western cultures didn't really have a big problem with arthritis. But then with the lifestyle changes that we see now, the easy life, that has become the norm, and you can see where we're heading. And if you look at the African and the Asian population groups, up till 1950, arthritis wasn't very well known unless it was a congenital problem they were born with, or a post-traumatic or injury cause for arthritis. But they've adopted similar lifestyles to the Western population groups, and now the arthritis has increased almost to equal the Western groups. So there is definitely lifestyle that's affecting the incidence of arthritis.
It's very fortunate that we have very good lifestyle programs available now, like the CHIP program, the Complete Health Improvement Program, that can actually address and even reverse these lifestyle diseases.
Yes, this is a very interesting program because it's the only one that has been published extensively. They've got more than 30 publications in peer-reviewed scientific journals, including the Journal of Cardiology in America and the British Medical Journal and the like. And we're very fortunate now that it has come to South Africa because it was very successful in America, then it went to New Zealand and then Australia, and now it's being introduced here. And I think the principles of that program is very important if we want to reverse cardiac problems in this country, and it's been shown to actually reverse some of the diseases, and if we want to slow down the increased risk of arthritis.
So it's important then for us to discuss some of these factors that influence the development of arthritis.
Well, Adele, let's have a look at the physiology of the joint. The joint is unique. It's different to other tissues in the body. Firstly, it doesn't have a blood supply that goes right up into the articular surface. So if we talk about cartilage, because when we talk about bone-on-bone arthritis, that means the cartilage cap that we've seen in previous videos on this presentation has worn out. Now those cartilage caps are made up of chondrocytes, and those chondrocytes, when they get damaged because of poor nutrition, then they die and we get arthritis. So how do the nutrients and the oxygen get to these chondrocytes? They come with the blood to the edge of the joint, and they go through the fluid in the joint called synovial fluid. And you need movement in the joint to get the good stuff, the nutrients and the oxygen, to your chondrocytes. And then you need to get rid of the waste products and the carbon dioxide out through the synovial fluid to the blood vessels to be expelled from the body. So anything that affects that will affect the nutrition of your joint and the incidence of arthritis.
Are there any other factors that will determine the outcome of your joint replacement?
Well, some of the factors that will affect arthritis will affect your outcomes after your joint replacements. And look at that slide there. It's a bit of a humorous slide. You can see the patient, our horse, complaining that he has a zebra hip replacement. He's not quite happy. Now, the factors that influence the patients getting arthritis are the same factors, lifestyle factors, that are going to influence the outcomes. And there are also factors on the surgical side. If we have surgical inaccuracies, there will also be failures. But the patient needs to know what are the things that they can do in their lifestyle to improve two things to have a successful outcome. Firstly, you need good immunity. You need to have good wound healing to prevent infection. Infection is devastating. And if you look how it affects people's lives, it's very tragic, because you have an index operation, and if you get infection after that, it's 2 further operations many times to control that infection without a guarantee that it won't come back again. And some people end up in wheelchairs or amputations if it's really bad. So we want to up the immunity. The second one is the bone strength. You build a house on a strong foundation. You want to put a metal implant onto a strong foundation of bone. And if you have osteoporosis or weak bone, the longevity of that implant is not going to last.
So as far as I understood osteoporosis, the main buzzword is calcium. It's like your calcium bank for your body that you can either make deposits into or withdrawals from.
Yes, osteoporosis, we can liken it to a big metal bridge. One of those big, beautiful bridges that have all those girders, those metal girders that hold it together. And you've got to ask yourself the question, how many of those girders will I be happy for them to remove and still drive over that bridge? Because the bone is built up on the same way. You have these trabecular girders with small little spaces in between. And osteoporosis means smaller girdles, less girdles, and bigger spaces until finally the load causes it to collapse. So yes, we have the bone bank, which is your calcium bank, which is your bones. And we're going to look at the factors where you deposit and then factors where you withdraw from that bone bank to control the strength of your bone. So let's talk about calcium.
Well, surely we need to take in enough calcium. And we know that for many, many years, the recommendations were a very high intake of calcium, and calcium supplementations were even recommended. However, now scientists have realized that we get adequate calcium from our diets if you eat a well-balanced, predominantly plant-based diet.
Yes, the studies that actually confused the scientists were when they looked at some of the big studies where they had 77,000 people, ladies, followed up over 12 years. They found out that their neck of femur rates were a lot higher in those who had the higher dairy intake, up to 47%. And there were other studies that came where they looked at ladies over the age of 65, and they took a history, and those who had daily dairy intake through their life, later on in life, the incidence of hip fractures went up by 190%, and some of them were up to 240%, which means the high dairy intake doesn't have the effect on strengthening the bone as we thought it did.
That's very interesting. So partly we know that calcium in dairy is not very well absorbed, but there are also other factors that influence the calcium withdrawal from bones when you take a high volume of dairy.
Yes, the problem with dairy is that it has a higher content of sulfur-containing amino acids as compared to other products that have calcium in. Plus it has phosphates, and both these sulfates and these phosphates, when it goes through your digestive system, gets converted to sulfuric and phosphoric acid. Now, you have a buffer system in the body, luckily, to keep your pH from becoming too acidic. And that buffer system is your bones. Calcium is drawn out of the bones to neutralize the pH. So you're getting a 20% absorption of your calcium out of dairy, but all the other factors are actually increasing the osteoporosis. And that's why these patients have osteoporosis. Now, in Somalia, they have a very low intake of calcium. The daily calcium intake is recommended between 1,000 to 1,300 milligrams for pre- and postmenopausal women. But in Somalia, they were getting 350 milligrams only, a third. And they were having a very low protein. 10% of their diet was animal protein. So with a lower protein and the lower calcium, they were still better. They don't have osteoporosis there. Whereas you have population groups like the Eskimos, where they were taking 2,500 milligrams of calcium a day, but they had a very high protein intake with a fish, and yet they had the highest osteoporotic rates. So there seems to be a more important factor on how much protein in your diet versus the calcium that you take in.
That is very interesting. But surely there must also be other factors that influence the actual deposition of the calcium into the bone.
Well, that's where vitamin D comes in. So vitamin D is required to absorb the calcium out from your small gut and deposit it into the bones. And it's very important, vitamin D, because it comes from sunlight. And we wouldn't think that we had a problem with that in sunny South Africa, wouldn't we?
Definitely not.
Well, on the contrary, South Africa is one of the highest deficiency rates of vitamin D in the world. And the reason for that is they've looked at Australia as well, as people slap on factor 50 when they get into the sun and put a hat on. And many people like myself are office-bound or indoor workers, and we don't get enough vitamin D. And that's very important, because a lot of my patients that come in that are vitamin D deficient have soft bone, and you try and put a prosthesis on this poor foundation, and that needs to be corrected. In fact, I have done a pilot study in my practice, and I've found that 9 out of 10 patients are vitamin D deficient. Now that's a group of healthy and unhealthy patients, a mixed bag, coming through for hip and knee pain, all ages, and that is much higher than what we expected to see. And we are now formulating an official study to see that. But if that's the case, it means that everyone with joint pain that is going for a procedure should consider having their vitamin D checked.
That's very interesting. Any other factors that would influence the deposition of calcium apart from vitamin D?
Well, now your vitamin D brings your calcium to the bones. Now your bones have cells in it as well. Remember the cartilage cells, we had the chondrocytes. Now in the bone we have 2 types of cells that are important for building up the bone. The one is the osteoblasts, the good guys who build the bone stronger, and the osteoclasts, which break the bone down. And you need that remodeling, building and breaking down to stay fresh and healthy. So the osteoblasts will work harder if there's more stress going through the bones. And it's classically likened to road construction site. We have the osteoclasts coming in, removing some of the old pavement and tar, and you have the osteoblasts coming in and building it wider, new tar, new pavements, and a stronger, bigger road, because there's more traffic going through. But your body is not going to go to that expense with its resources if you're not exercising the bone. That's the traffic through your skeleton. The more impact and exercise that you do, the stronger your bones are going to be, because the osteoblasts are going to build more bone. And it's not going to happen without exercise.
Well, exercise also impacts on other lifestyle diseases. And I've heard that the lack of exercise is likened to the risk that smoking poses to an individual.
That absolutely shocked me when I heard it the first time, that someone who smokes moderately and exercises enough is often healthier than someone who doesn't do any exercise and doesn't smoke. Exercise is one of the single most important factors for lifestyle medicine and a healthy body.
Now, we've spoken quite a bit about calcium being deposited into the bone. Let's speak now about factors that will withdraw the calcium from the bone.
Well, the culture that we live in now is a caffeine culture. We like our energy drinks and we like our coffee. That's one of the factors that can actually increase your calcium loss through your kidneys. And they've shown that for about 3 hours after you've had 1 cup of coffee, that you have a negative calcium balance. You're losing calcium from the increased diuresis that happens. And that can be concerning, especially when you add some of the other factors. Now, one other factor that's important in reference to this biology of the bone is alcohol. One of the studies that have shown, we know that alcohol causes osteoporosis, but a concerning study is that they've seen that ladies who start drinking at adolescence or their 20s, they have irreversible damage to these osteoblasts, so that the osteoporosis later on in life is virtually impossible to reverse.
What about other substances that we ingest, like salt and sugar? May they also contribute to the loss of calcium?
Yes, you have, if you look at salt, the salt in our diets have actually increased in everything that we eat, and it's made up of sodium chloride. And the problem is that your kidneys are programmed to prioritize sodium over calcium. And there's a sodium-calcium pump, so you actually will lose calcium through your kidneys in preference of saving sodium. And excessive salt doesn't just lose calcium out your kidneys, it also raises your blood pressure with all the side effects that we have and the medical conditions that brings.
And what about sugar?
Sugar is very interesting, Adele. The problem with sugar is that it's on the rise. We'd think that people are aware of it. But in the 1800s, Department of Agriculture in America has shown very clearly that back then the average person was only taking 4 to 6 pounds. That is 2.5 kilograms of sugar per annum. Now in 2014, the sugar increase has gone up to 150 to 270 pounds. That's about, in kilograms, 73 kilograms, almost like an average weight of a man per annum. So the sugar increase in our diet comes in sodas, especially, tomato sauce, certain breads, and all the little cakes and chocolates that we so like to eat.
So I've heard that 1 can of soda contains up to 9 teaspoons of sugar.
Yeah, soda, and there's many people that drink soda, and especially the brown caffeinated sodas. You have caffeine that robs you of your calcium. You have phosphoric acids, and so with